stops admitting patients after two doctors, a nurse, and a clerk at the hospital tested positive for the virus. We now speak to Mayor Benjamin Magalong. Mayor, good morning, sir.
Good morning, Leah. Good morning, everyone.
Mayor Magalong, what made the BGHMC decide to stop admitting patients? How serious is the situation there?
Now, I would say it's a bit serious because for the past 3 days we have 10 transmissions. We have 3 doctors got infected, 3 nurses, 2 nurse attendants, and 1 hospital clerk. So a bit serious, and we're expecting that there will be more transmission or positive cases in the next few days because we have been aware now conducting extensive testing among health workers. And we would like to really find out what is the real situation because during the past weeks, all this data that we're getting are practically artificial, considering the fact that we don't have any extensive testing.
Now, with the hospital no longer admitting patients, sir, what will happen to patients? Where can they go if they're sick?
Okay. First, this is an arrangement that is temporary. For non-COVID and non-emergency cases, this will be referred to the St. Louis University. Arrangements have already been made with the medical director and staff. For life-threatening situations, they can still proceed to the Baguio General Hospital Medical Center, including mild COVID cases and severe COVID cases. There are special wards that were set up at the Baguio General Hospital. So we're only talking about non-COVID and non-emergency cases.
I see, sir. Now, you mentioned data earlier on. Can you please give us an update on the latest number of COVID-19 cases in Baguio City?
Okay. As of yesterday, at 3 o'clock, we have 29 confirmed cases. These broken down into 16 active, 12 patients have recovered, and here's one. We have one particular death because the patient had an underlying condition. She had tuberculosis. So out of the 16, it's composed of 10 health workers, and mostly at the age of 29 to 55.
Sir, with the recent reported cases in your areas, aside from no longer allowing admissions to Baguio General Hospital, what measures are you taking to stop the spread of the virus?
Oh, we're doing the mass testing. In fact, we're ramping up testing up to 200 plus a day. And we're hoping that in the next few days, hopefully we'll be able to get more test kits from the Department of Health. And we'll be able to, go as high as 300 to 400 tests a day. Because that's the only way we'll be able to, determine the actual situation. Just like in a battlefield, you have to have situational awareness, and that's precisely what we intend to do. For the past, since the start of ECQ, we already received about 8,100 test kits from the Department of Health and 1 PCR machine. And we have been prodding Department of Health to add more. And that's the reason why what the local government unit did was to ask help from donors. And we also placed our own orders, but because of the considerable demand, we're getting a lot of difficulties getting supplies.
Yeah, testing is really the key. Lastly, Mayor, how is the local government doing with its assistance drive?
Okay, if you're referring to our social amelioration programs, like the distribution of the food packs, we're doing okay. We're spending about 10 to 12 billion a week now. We're good that the SAP was executed or implemented, and that would reduce the number of food packages that we're preparing every day, because those who will be receiving the special amelioration fund will no longer be entitled with the food packs. I'm also glad that our our community quarantine or enhanced community quarantine was extended because we can still avail of the second tranche of the Special Amelioration Fund. Right now, we have already hit around 55%, and we're going to ramp up the process so that by the end of the month, we will be able to cover practically 45,000 families.
All right. Certainly good news for your city. Thank you very much for joining us this morning, Baguio City Mayor Benjamin Magalong.